So we'll quickly look at what repair of injuries by healing, scar formation, and fibrosis. Okay, so this mechanism, they basically go hand in hand. All right, so if there's an injury, there'll be healing, there'll be scar formation, and there was fibrosis. All right, so we'll be looking at this concept. All right, so just to remind ourselves, if there's an injury, there will be clot formation, which is caused by what clotting proteins and what plasma proteins, and a scar can be formed. Okay, so epithelial cells can multiply and fill in over the granulation tissue. All right, so next there'll be restored epithelial, the restored epithelial thickens and the area matures and contract. Okay, so all this is basically what healing, scar formation, and what fibrosis, right? Because this fibrosis could see what lots of fibers here, right, and all that, right? That's what they call fibrosis, right? So now we said that healing of wounds is a fibroproliferative response. Okay, fibers have to proliferate. Okay, so you see this as scar tissue, right? Proliferation of what? Fibroblast. So these fibroblasts need to what? Proliferate. Now, when they proliferate, they patch, right? You see that is a healing is a fibroproliferative what response that patches rather than restores the tissue. It will not restore the tissue exactly how the tissue was. It will only patch. Okay, so it's also a complex but orderly phenomenon involving a number of processes, right? And these processes will have it as what? There's induction of an inflammatory process in response to the initial injury, with removal of damaged and dead tissues, right? There's also proliferation and migration of parenchyma and connective tissue cells, okay? There's also formation of new blood vessels, that's angiogenesis, and granulation or tissues, right? So you see here, you see when there's bleeding, there'll be inflammation, there'll be proliferation of what fibroblasts, there will be remodeling, okay? Let's talk about the last process that will go back. There's also synthesis of what extracellular matrix proteins and collagen deposition. This is basically what to harden the area. Okay, there's tissue remodeling, just like we say here, tissue remodeling, trying to bring the tissue back to how it was, right? Usually not possible, but usually not 100% possible, but at least you have something alike, right? There's wound contraction and there's what acquisition of what wound strength, right? So here they have it as what tissue capable of what regenerating cells. Now, okay, tissue without a scar, right? So basically the tissue come back to how it was, all right? So some tissues can come back to how they were, and some tissues might not actually what come back to how they were, right? So this is how repair by healing, scar formation, and fibrosis basically what take place. All right. So guys, that's it then. See you guys pretty soon.